Good morning. It is almost 3. Oh, it's after 3. It's after 3 a.m. in Colorado. I'm in Greeley, Colorado. Um, I woke up this morning um, knowing that I needed to talk because it was on my mind. Okay? I went to get my iron infusion today and my weekly fluids that they usually give me. And my nurse took her hands and put her naked fingers on my skin. As a cancer patient, we are always worried about other people's germs, and I figured that my nurses would already know that. So then the dots became in the connection phase for me. So when I got this port, while I was still in the hospital, the nurse who discharged me from the hospital gave me education about my port. And she told me point blank, do not let anybody touch your port without gloves on and unless they're a medical professional. Do not let anybody just touch it. I took her words to heart. She was the mothering kind of nurse, the lady that instructed me on how to handle and take care of my port. As you can see, my port even still has a halfway healed incision mark from where they put it in, which to me says that's an avenue for germs to get into me. That's what it says to me, right? So today, while I was getting my iron infusion, my nurse that was assigned to me on the floor, the first thing she does is touches my skin with no gloves on. I understand that some medical professional people don't like to wear gloves. I'm in the middle of COVID-19 finding out that I am a cancer patient. And hygiene has become my top priority because my immune system is lowered now that I'm taking chemo treatments. And for somebody who's dealing with me not to use their gloves tells me you don't have that same barrier, and my health is at stake when you're dealing with me. This lady, it didn't dawn on me when she was dealing with me because I'd never had this experience before, but I decided to record all of my firsts. And this is a first for me. I've never had a medical professional since I found out I had cancer try to deal with me without gloves on, except one time when I went to get a CT scan, and that was in another facility outside of UC Health. This lady, this one person, and I'm not going to let one bad apple ruin it for everybody. She was in my normal oncology facility, and I went to get my normal weekly treatment, and she did not want to wear gloves, and I kept having to ask her. And then when I first asked her, approached me in a way that I didn't know what I was talking about. Tried to make me feel like I was wrong because this is normal. We don't put on gloves until it's time to put on the sterile ones. That threw me. This ain't my first go round no more. You supposed to wear gloves when you dealing with anything dealing with me. I don't care if it's putting my IV tubes up. You supposed to have gloves on. And she refused to wear gloves. She kept saying okay, but she was very slow to put them on and still was dealing with things on my IV and my pump. And this offended the crap out of me. And I was in the middle of handling my own business, so I couldn't immediately say to her, my brain did not click over fast enough to say to her, the first time that she touched me, it threw me off. I was like, you're touching me. You don't have gloves on. And she says, oh, yeah, we don't use the sterile gloves until we get to put the medicine in. I was like, okay. To me, first red flag. Boom, boom, boom. Very, very bright red flag. And she says that to me when I know for certain she's supposed to be wearing gloves the whole time she's dealing with me. Cancer patients, I know that this may be your first go round, but I'm telling you, do not let anybody touch your port without the proper PPE on. Do not. You are a cancer patient. Your immune system has dropped lower than the rest of the population. Protect yourself. Do not allow workers to work on you without the proper PPE. And I'm talking about personal protective equipment, what you use at work. These people who are working on you in the medical facility are at work. They're supposed to use the proper PPE to take care of their customer, their client, their patient, their cancer patient. You are the cancer patient. Be your biggest advocate and make sure people are at least using regular medical grade gloves to work on you with everything they're doing. I was very flabbergasted that this lady decided she wanted to be so lazy, careless, and haphazard not to use gloves on me and then touch my skin with her human skin. And it's COVID-19, and I'm a cancer patient without all of my immune system because of the chemo treatment that I'm receiving from their facility. I'm still mad. I woke up out of my sleep mad because I could not get it out. So I had to make this video to tell other people because I'm recording all of my firsts. And this was a first for me. That a female nurse came and dealt with me with no gloves. But she was very concerned that I had my mask on. But she was trying to kill me with no gloves, as far as I'm concerned, standing on the side of being a cancer patient with half of an immune system. That's a death sentence for me. Normal germs I have to be careful of. And her normal human germs should not have made it to my skin, no matter how much hand sanitizer she was using. When you use hand sanitizer, it does not take the dirt off of your skin. It kills whatever germs are there, right? You still got dirt on your hands. You still got dirt on your skin. Put the gloves on. I'm a cancer patient. Respect that you are supposed to be taking care of my immune system. You are responsible for me. As a cancer patient, my nurse is responsible for me. Be responsible. Do the minimum. Wear freaking gloves while you're dealing with me. That peed me off. Cancer patients, don't let no one deal with you without gloves on unless you got a death wish. Don't do it. Sorry I had to get on here so stern, but I am mad as all wildfire. And now I have to make a report on a nurse that she's got a good personality. She was careless and lazy. And we don't need to be careless and lazy when we got such an important job.